Hello, I'm so happy to see both of you. Before we actually dive into the updates on Bridges to Health and Healthcare, Nicole, just give a short introduction, shout out.
Absolutely. I'm super excited for what we'll be discussing. And I am a national consultant with AHA Process. I'm certified in Bridges Out of Poverty. It's been a little over a decade, this amazing journey. And I've also been along this journey for Bridges to Health and Healthcare. I've been certified for about 7 years now and maybe a little bit longer. And it's always a great pleasure to be able to come alongside healthcare organizations, healthcare institutions to help them optimize. I worked in healthcare for many years as a director of social work services. So this is a passion of mine. I'm really excited about this.
Good, thank you. And Susie.
Wonderful. My name is Susie Johnson Smith, and I also am an AHA consultant and have been for a little bit less than Nicole. I think I'm a couple of years behind you on both Bridges Out of Poverty and Bridges to Healthcare, Nicole. Joined the team a couple of years behind, so I've been doing this for about 7 or 8 years, but entrenched in the Bridges Out of Poverty work for over a decade in my community, training and building critical mass and supporting organizations to embed all of the constructs and shifting policies and procedures around the Bridges framework and model.
Good, thank you. So we knew here at AHA Process that the Bridges to Health and Healthcare workshop needed to be updated, and that's why you were asked to do that. So Susie, do you want to lead us off and just talk a bit about some of the changes, and then Nicole as well, please chime in.
Sure. Nicole and I had a lot of fun with this. We both were involved in updating the certified training for Bridges Out of Poverty. And then when you asked us to work on the Bridges to Healthcare, it just sort of naturally started to flow because we had been updating a lot of the data to do with Bridges Out of Poverty certified trainers to begin with. When we dove into the Bridges to Health and Healthcare, we really, built upon that relational model and built on what was already a really good, excellent framework and workshop. But we updated the data sources, the research, and really, worked on the relational model and introducing that relational model that's in line with the triple aim of improving healthcare experience for all.
Yeah, Susie, you kind of hit it right on the head. As many of you know, the Triple Aim was launched to optimize healthcare systems many years ago. And since then, healthcare has evolved. We had a pandemic not so long ago. We were experiencing the throes of 2020. And so much has changed when it comes to healthcare. The evolution continues to happen. And we realized that with Bridges to Health and Healthcare, that needed to take place as well. And so, just as Susie mentioned, we just dove deeper into the relational model. We understand that Bridges to Health and Healthcare is an add-on. It's an additive model as well. So it's the amazing and great work that's happening each and every day within healthcare. But how can we add on to that model with the Bridges to Health and Healthcare framework? And so, yes, we definitely took a deeper dive into the relational model.
Good, and thank you, because now we do have an updated workshop that you can do either in person, or we can do it virtually online, or there's an on-demand. So there's 3 different options to get that information. So I know the next question that I'll be asked is, okay, I'm already certified. Will there be an update to that? Will there be a recertification for me?
Yes, there is absolutely an update to the certified training and the recertification. And so if you're already certified, we highly encourage you to go through the research and just get up to date with the new data, just some of the concepts in regards to the framework of Bridges to Health and Healthcare. And then there's also just some more information in regards to on-demand training. I know, Susie, if you want to touch on that piece with trainings, we're able to both to come out and train in person or train virtually, or it's on demand. And so there's so many different ways to get up to date with Bridges to Health and Healthcare.
Absolutely. We just re-recorded the on-demand workshop, so that's available now at any point. And like Nicole said, we're happy to come out and support your organization in person or have an online workshop. And we plan to have the new recertification or new certified training available to you all for the new year. So we are currently working on that, and we will have that available for you to be able to recertify for new Bridges trainers that have been certified or recertified in the new updated 5th edition. Then we highly encourage you to get certified in Bridges to Healthcare or recertified with the new material in the new year as well. We're working on that as we speak.
Thank you very much. I know that the new information will be very helpful to those who hear it.
Absolutely.